Hey, good morning, guys. Thank you for taking time out of your day to your injury prevention and movement screening and how that relates to optimizing performance and having your most successful, pain-free, injury-free 2023 golf season. I'm really excited to share this content with you all as I feel like it's particularly timely with the Players Championship coming up this weekend and the official start to the golf season upon us. The grass is going to be greening up here in the next month or so, and we're going to have a lot more opportunities, hopefully, to get out there, work on our game, and spend some time with our friends and family members, really enjoying the game that we love. Just to start off this presentation, I want to give you guys a heads up on who this presentation is for and what our intention is with it. And we're really looking to help provide people with information on how movement and things like coordination, balance, flexibility, mobility, strength, and stability can all play a vital role in our golf swing. And by optimizing some of these things and specifically screening what we need to work on as individuals, we can help to optimize the time that we spend in the gym or doing corrective exercises to help reduce our risk of injury and help us to play the game that we love more often without fear of pain or injury. Who this class isn't specifically for is for those of you who are looking for more specific swing tips, um, working on building speed or capacity specific to the golf swing. In that case, I'd be more than happy to provide referrals or recommendations to um, golf performance and swing specific coaches in the greater Denver area. Um, just go ahead and reach out if you are interested but don't know who to talk to in that respect. I have my phone and email contact information will be at the end of this presentation. So go ahead and stick around, or you can fast forward to the end there and go ahead and reach out to me. I'd be more than happy to provide you with a recommendation in that case. Okay. Just to give you guys a background on who I am, my name is Dr. Jordan Adrian. I'm an orthopedic physical therapist and the physical therapist on site at Cherry Creek Country Club. Typically there a couple days a week on Tuesdays and Thursday mornings at this point in time, um, which has given me the opportunity to start working with more golfers and see a lot of similarities and commonalities between deficits that people in the golf community will pick up on and screening people effectively to make sure that they're spending time working on the right corrective exercises and movement patterns to stay healthy, but also to recover from injuries after they've occurred too as well. My background growing up is actually in having played baseball up through undergrad, also played basketball and soccer, but actually picked up golf after my baseball career was over and have been playing now for 8+ years. Love the intellectual part of the game, just the full body aspect of things, and being able to always have something to work on to get better. Um, I I did graduate from Rockhurst University in Kansas City, Missouri in 2016 with my clinical doctorate and went on to have several clinical experiences while in school, working with an active adult population with a particular emphasis on people looking to stick around and participate in their recreational activities, including golf, for as long as possible throughout the lifespan. So to dive into the actual kind of meat and potatoes or content, want to give you guys a little bit of a background on golf-specific injuries. How often do they occur? What specific body parts are most frequently injured? And I was really fascinated to kind of see that the incident rates in golf are actually higher than some of the contact sports like rugby and hockey, and even skiing and snowboarding, where we would assume that there's a higher risk of injury just due to the physical nature of that particular sport. However, just goes to show that um, injuries can not only occur in more of an acute or traumatic type fashion, but also that overuse and poor mechanics can contribute to pain and injury at a fairly high rate. So golf definitely falls into this category, to where more often than not, repetitive stress over the course of time or poor swing mechanics or poor movement patterns can make it more likely that we start to experience pain or an injury that becomes nagging, and limits our ability to get out there and play or practice on a regular basis. The research does show, and we definitely see this in clinical practice as well, that lower back injuries are the number one type of injury that golfers will experience, with up to 34% of pain or injury in golf um, being related to the lower back, fairly closely followed by the elbow when we think of golfers, or tennis elbow, and then to a little bit of a lesser extent, shoulder and wrist injuries. Did find it fascinating that pros experience injuries at almost 2 to 2.5 times the frequency of amateurs throughout the course of the year. And again, just goes to show that overuse or too many repetitions can make it more likely that we end up having pain or injury that sidelines us from the sport for a period of time. Yeah. So, just to give everyone a little bit of a background on kind of where injuries occur, and ideally which muscle groups we should be feeling in the different phases of the golf swing, um, we'll find that the follow through is actually the portion of the swing where the highest incidence of injury occurred, followed by the downswing. And so, if we can understand what muscle groups we should be feeling in these specific portions of the swing, we can have a better idea if we are doing things to compensate and use other muscle groups, put stress um, abnormally on different parts of the body. Then it can give us a basis of comparison to figure out what portion of the swing, what sort of mechanics, or what areas we need to target to help to reduce and kind of spread stress across the body more effectively. So if we start off in the backswing, typically we're going to be looking at from the ground up, getting muscle groups like our quads and the muscles on the inside of our thigh activated properly to create force through the ground that gets transferred up through the middle part of our body. We're going to get some rotational movement, which means our obliques are going to be involved. And then hopefully our shoulder, especially our back shoulder in the backswing, is going to have enough external rotation there to successfully get us to the top of our swing. And in an ideal scenario, we're spreading force across these multiple joints in multiple areas so that not any one particular spot is taking the brunt of the load. Okay, moving on to the downswing and up and through kind of impact or contact there. We're going to be unwinding from what we worked on in the previous phase. We're going to have to use our glutes to drive our back hip up and under. Again, we're going to be using our obliques, but kind of opposite capacity to start our rotation through the downswing. And then from an upper body perspective, in this particular position, our pec muscles are going to play a more vital role in helping to keep our arms connected to our body. Okay. And then, as I briefly mentioned earlier, the follow through is actually the phase of the swing that we find the highest incident of injury occurring in. And a lot of times, again, with lower back injuries being the most common site of pain or injury in golfers, this can very very specifically linked to the follow through and the position of our spine, how much mobility we have through our torso, through our hips, and how effectively we finish turning, as well as the ability for, in this case, the left shoulder for a right-handed golfer to be able to fully externally rotate to get into that position, so that we're not just hinging and putting too much stress on the last couple levels or joints of our lower back. Um, So again, just a real quick visual of the different phases of the swing and the incident rate of injury in that specific phase of the swing. Follow through is the, up at 30% of injuries occurring in that particular phase of the swing, with the downswing being a close second at 18% there. Okay. And then just a quick graph on some of the different factors leading to injury and pain in golfers. Like we mentioned earlier, overuse can be a large contributing factor. Too many swings without enough of a break on the practice range. And it was really interesting to discover that the majority of golf injuries actually occur on the range rather than while the person is playing. And a big part of that is having multiple swings, hitting 70, 100 balls in a 30-minute period, as opposed to being spread out over 4 to 4.5 hours through a typical round. I will often encourage people to simulate like they're actually playing around while they're on the range, so that they're varying the length of the club that they're using. They're taking a little bit more time in between swings, and their overall volume of work is going to be lower for a specific time frame. Swing mechanics as well is actually kind of the number one factor that they found as a mechanism for injury in golfers, and not having sufficient mobility through our hips, our mid back, our torso, having poor coordination or balance, um, not having enough strength and stability to support our joints in different portions of the swing can all contribute to suboptimal swing mechanics. And that's where it's so important to do an assessment periodically throughout the course of the year, as well as ideally before the year starts, so that we can address any particular areas of concern that could inhibit our ability to have appropriate swing mechanics or have enough capacity to avoid some of these overuse injuries that we see at such a high incidence rates in the golfing community. Okay, and then as far as how long does a typical golfer have to take off or either modify not participating in practice or not participating in any golf-related activity at all after experiencing an injury? Fortunately, the vast majority of people will be able to make it back into at least playing, and then eventually back into practicing at a higher rate within a 4 week time frame. Although, as you can see, up to 15% of golfers will be out for up to 12 weeks plus from there, with more severe injuries and more severe deficits in their swing mechanics that they need to work on in improving, to ultimately allow things to calm down and allow them to get back into playing successfully without compensation. Yeah. And then I found it fascinating too, as well, looking at how age and injury are connected in the sport of golf. Found that the highest incident rate of injury is in the population of people between 50 and 65 years old. And a big component of this is some of the changes that occur as we do get older. We tend to lose some flexibility, especially in our older men that love the sport of golf. Tend to be a little bit more stiff. Our connective tissue isn't as mobile and as flexible as what was before. Our circulation can start to decline, especially if we have other health issues going on, such as diabetes or cardiovascular disease. And it takes us a little bit longer to warm up. We'll typically experience a decrease in power production, decreased ability of the muscles to coordinate with one another to produce speed, and then our balance naturally starts to decline as we age, especially if we're not doing preventative work or work in the gym in order to help kind of maintain some of that we had before. Okay, so the fortunate thing though is that many of these factors can be slowed down substantially, and a big part of that is identifying areas that you can improve upon, and then knowing what you need to work on, and then actually implementing it into a consistent routine on a weekly basis, so that you are addressing these potential risk factors for injury. So just to kind of build on that, I mean, how do we implement these things, and how do we stay healthy? Again, everybody's a little bit different, and their bodies are unique, and the things that they need to work on can be completely different from one person to the next. So if you were to try and focus on flexibility and mobility, but your primary issue is that you are starting to lose coordination or strength and stability, you can actually increase your risk of injury, uh, decrease your ability to optimize your swing and your health. And so being able to assess effectively your specific needs is critical in order to have the work that you're doing in the gym and in between rounds really pay off for you. So as a general rule, we will see a lot of um, areas of commonality between different types of golfers and the areas that they need to specifically work on. However, it can vary again from one person to the next if they need strength, stability, coordination, or again, for a lot of our older men, we need some more mobility through our hips and our spine, our wrists and our shoulder, so that we're not taking on too much stress in any one particular area. Okay, and that's where working with a good physical therapist can really assist in your decision-making process as far as what you need to work on, both in a preventative capacity, trying to work on identifying areas of improvement before injury occurs in the first place. It's always easier to put in a little bit of work up front and try and prevent overuse injuries in the first place than it is to try and overcome injury or pain once it's already started. So, highly encourage you if you are going into the season or looking to stay healthy to be preventative about your health. And then for those who are already experiencing pain or an injury, having the right advice on how to effectively progress back towards the range, back towards playing at an appropriate pace without running the risk of flaring things back up or compensating and creating issues at other joints and other muscle groups around that initial site of pain can be incredibly valuable too as well. So when it comes to mobility through the spine as well as the hips, we need to make sure that we're looking at movement in three separate dimensions. So our spine is designed to rotate. It's designed to flex side to side or side bend, as well as flex forward and back into what we call flexion and extension. With the golf swing being such a dynamic movement, it incorporates all three of these different dimensions, and a lack of mobility in any of these planes can potentially put us at risk. So being able to look kind of specifically at various combinations of these different movements can help us identify areas where we might be a little bit more deficient and can help guide us in our exercise selection to minimize our risk of injury. And then on this slide, just a few examples of corrective exercises depending on what your findings are. If you're lacking side bending, working on some side to side motion. If you're lacking rotation through the mid back, then we can do things like side lying upper trunk rotations with this picture on the top on the right. Or if we're a little bit more limited in our hips, in our lower back, then we can start to do more specific exercises that resemble the last couple of pictures on the bottom part of this slide. Okay. It's also critical for us to assess and look at wrist and forearm mobility. Again, just like with the spine, we have multiple different directions that our wrists and our forearms need to be able to move in optimally. If not, we can start to stress other areas up the chain into the shoulder, or we can develop things like golfer's elbow or tennis elbow that can be really nagging injuries that take a substantial period of time to fully recover from. So looking again at just a couple examples of corrective exercises to work on mobility deficits in this region, we have exercises targeted at pronation and supination, or a rotational movement of the forearm, flexion extension, which is more of the forward and backwards movement of the wrists, as well as ulnar and radial deviation, which is the side to side movement of the wrist and hand. And then our coordination component involves our core and our hip muscles. And again, with the golf swing being so dynamic and taking place in 3 different dimensions, we're going to need to look at our muscle groups like our obliques, as well as our deeper rotators in our hip and surrounding our hip joint, and then our primary drivers that help us to produce power and push off through our back leg, especially with our longer clubs like our drivers and our woods. We want to make sure that we're optimizing and coordinating these muscle groups effectively in order to help to control some of that mobility that we just mentioned in the previous few slides there. So, and again, just a couple of examples of corrective exercises I'll utilize with people to improve the function of their obliques, get their glutes firing appropriately, and help them to support their spine, their upper body, as well as start to produce some more power in their swing. Love to be able to utilize things like medicine ball tosses, rotational patterns, wood choppers, things of that nature too as well, that are great for people in the rotational sport community. Okay. And then we also need to be able to look at hip mobility too as well. So a lot of times in our lower back injuries, the hip mobility or a lack of rotation or flexibility in the hips can place excess strain or stress on our lower back. And even though that's the site of our pain, it doesn't necessarily mean it's the root cause of things. So people that are trying to just directly apply patches or creams to the area of pain. They're focused only specifically on where that site of the pain is, might be missing the bigger picture as far as actually determining the root cause of why that pain started in the first place and coming up with a successful game plan to make sure that that pain or that injury stays away for good. So with our hip motions, we're going to have some internal or external rotation, more rotation in and out of the hips. We're going to get some movement in and out with the legs moving kind of in and out. And then we'll get some flexion and some extension when we think about coming up through impact and through the follow through, needing to be able to extend at the right time, effectively using our glutes to help us raise up and complete the full arc of the golf swing. So again, just a couple of quick picture examples of exercises I'll have people work on if hip mobility is an issue for them. Again, addressing multiple different planes, in and out, rotation, forward and backwards, depending on where your limitations at, can make a huge difference. And then doing exercises with one leg at a time can help you to produce more symmetry between the right and the left side as well. Okay. And then we also will like to look at things like upper and lower body coordination and the ability to move one part of the body separately from the other part of the body so that we're able to create lag in our swing, as well as control and coordination to ultimately release the head of the golf club into the right position at impact and follow through. Um, and so, looking at exercises that do help to create movement and control in the upper body versus the lower body at different periods of time, depending on whether or not you're having more of an issue with lower body stability versus torso or trunk stability. Helping to control lower body rotation will help to ultimately guide which exercises make the most sense for you to get started with for your specific movement deficits. Um, And then balance, of course, plays a huge role in our ability to create a stable foundation and produce a foundation that we're able to create power up through the ground. As we know with the golf swing, all of our power and our stability comes through our 2 points of contact with our feet in the ground. And so if we're not stable there, the rest of our swing is going to be built on a shaky foundation. We'll look at things like how people's vision, their overall body awareness or proprioception, as well as their vestibular system, is impacting their balance and making sure that we're doing what we can to optimize or we're referring out to other providers that specialize in those particular areas to make sure that we get any of those issues addressed or taken care of as much as possible so that it's not impacting the swing. Okay. And again, just a few examples here of different, particularly single leg movements. Again, if there's a difference right versus left, with our higher irons, with our taking a descending blow, if our front leg isn't quite as stable as what it needs to be, this can make that transition uncomfortable for people and have them starting to compensate through their upper body or not trusting that lead leg in order to finish on that side. And so we want to work on doing exercises to help bolster that ability level to ultimately improve your confidence in being able to kind of transition weight from one leg to the other. And then just overall general things for people to consider in order to reduce their risk of injury prior to starting a round and prior to arriving at the first tee box. I want people always to consider what time they're teeing off at. Typically in the morning, first thing getting out of bed, our joints are stiff. Our circulation to our skeletal muscles has been decreased over the 8 hours, 6 or 8 hours we've been laying in bed. Typically, our body will divert blood flow towards our internal organs. And so we need to just start to get things warmed up a little bit more in the morning. Typically, do something like walking or cycling to get the blood flow going. Might need to do some mobility work, kind of a dynamic warm up to help get the joints lubricated again. And then again, knowing specifically what areas you're deficient in can help to guide what that warm up routine would look like. Um, you also want people to look at whether or not they're going to be walking or riding for that day. Typically, while we're walking, we're keeping that circulation going. We're keeping muscle groups activated versus when we're riding, especially if there's slow play on that particular day or in a tournament where there's a lot of teams involved and we've had a shotgun start. We might need to do some more things kind of in between shots in order to stay limber, especially if our weather is a little bit colder or wetter towards the beginning of the year around springtime or going into the fall and winter. Um, we need to take a little bit more time to make sure that we're staying warmed up in between shots and not just sitting in the cart with poor posture too as well. And then I also always have people consider what are my unique health issues and do I have again things like cardiovascular disease, diabetes, chronic illnesses that are impacting my ability for my body to get energy and circulation to the skeletal muscles that ultimately need to be able to be utilized to play the game of golf. Okay. So, um, if you're looking specifically to figure out where you need to start in order to kind of bulletproof your body against pain and injury for the 2023 season, or if you've already developed pain or been dealing with a nagging pain or injury for a while and feel a little bit stuck and just don't necessarily know what you need to do to ultimately resolve that issue for good, um, I will love to work with people to really effectively screen or assess the root cause of those issues, as well as look at things that they could improve upon from a mobility, again, stability, strength, balance, coordination, respect, to come up with a game plan to make sure that you're optimizing your time and your effort in order to have that translate over into better play, healthier play, more opportunities to get out there in the 20 to 23 season. So things that we'll look at in our specific golf movement screening are things like your pelvic position, how well your pelvis and your hips, lower back are rotating, how well are you differentiating movement between your upper body and your lower body, how much of that's actually related to a limitation in mobility versus how much of it is related to balance or a lack of stability that's causing your body to not feel comfortable rotating or moving into specific positions. So, fleshing out some of these differences can be critical again in exercise selection. We'll also look at things like your lat flexibility, your upper body flexibility to help you to get into specific positions, as well as how effectively certain muscle groups, specifically how your glutes and your posterior chain, your hamstrings, are working to create power and drive. And if there's a difference right versus left, that could be putting additional strain on joints like your knees and your lower back, and much, much more from there, all specific to golfers and the different joints and different muscle groups that golfers specifically need to use to stay healthy and to perform well. Okay, so based on the results of this screening and this movement assessment, again, it gives us real clear guidelines on what your specific areas for improvement are, and it helps to guide a formulation of your customized exercise program that's 100% personalized to your individual needs. We'll also typically take video of before and after. And after people have been working on some of the corrected movement patterns for a specific period of time, weeks or months, we'll go back and retest some of those things so you can visually see the improvements that you've been making. I'll also a lot of times have people kind of keep track of or journal their pain level while practicing or playing, or how many days or weeks they're able to get out and play versus being sidelined due to injury too as well, so that we can really have a good idea of the impact that we're making, and help you to stay motivated to keep up with some of the preventative or rehabilitative work that we've recommended by working together too. So, yeah. Okay, so if this does sound like something that you would benefit from, or you have more questions related to how we can come together to make 2023 your best year and keep you healthy for the entire season, I am available via phone or video calls, or for members over at Cherry Creek Country Club. Um, you can always set up a consultation through the 4Ts app, or book an initial assessment through the 4Ts app too as well on Tuesdays or Thursday mornings. I'm available via phone at 720-780-0011. Or if you have more questions, my email address is down below too as well, where I have a link to where you can book a 10 to 15 minute time frame for a call to be able to gain some more information and make an informed decision on your health in 2023. So thank you guys so much for your time and attention today, and hopefully you've found some value in the content that was provided here, and really excited for the season to get started and for everybody to have their best year yet in 2023.